Friends, myself Zubin Bhatt, student of Infection Risk Management Level 7 of Toy Ohama Institute, Rotorua. My student ID is 300100414. I'm here to present my presentation on hospital acquired infections. I'm going to describe its mode of action, mode of transmission, its risk associated with the hospital acquired infection, and some national as well as international guidelines, New Zealand national guidelines as well as some of the international guidelines. Um, as per the framework of educational resources, which is affiliated by the healthcare opportunity for enhancing and working professional with a healthcare institution. It's an additional according to the hospital acquired infections. It has been affiliated by an economical strain as well as some quality services. This paper particularly is aimed for critically analyzing and discussion in detail about some assessments of educational resources in respect to its mode of transmission, like how the diseases are transmitted in hospital acquired settings. Furthermore, an opportunity implication of healthcare measurement is playing a crucial role in ordering and maintaining suitable approach towards industrial practices. In addition, in order to align with this particular research paper, it is described in for the insights. Let's discuss some mode of transmission, how it's been transmitted in hospital acquired settings. First one is direct contact. Direct contact is when a patient is coming in direct contact with either the staff or like some healthcare worker or doctors or other, and is again coming in contact with the patients. And this way, patient is transmitting an infection to the reservoir. Here, infection is getting a new host, and this way the infection is transmitted. Second one is an indirect contact. Direct contact and indirect contact has a main difference. The main difference is uh, there is no physical touch between for in an indirect contact, and there is a physical touch in direct contact. Third one is a droplet infection, and fourth one is an airborne infection. Let's describe all this in brief. The mode of transmission, such as direct contact, is said to be the most virulent or most harmful for transmitting diseases in healthcare settings. Microbes are considered to be directly transferred from an infected individual to the non-infected individual. Therefore, it leads an increase of significance for a virus as well as its risk which are associated with them. For example, contact transmission is emphasized by body fluids like blood and other fluids which are there in the body. Other mode of transmission such as indirect contact. Let's discuss that in brief. Yeah, a contaminated intermediate objectives are involved in this. For example, the most common microorganisms such as Acinetobacter baumannii or C. difficile, which are found mainly in the diarrheal infection in hospital settings, they are affiliated for increasing an indirect contact. Like a patient drops an infection, like when an unclean or less sanitized equipments are used, like the uh, bad linens or toilets which are not clean, on the surface, the life or the organisms which are not dead are stayed. And when a patient goes and carries infection from those places and gets furthermore longer stay, this sort of infection are called as nosocomial or the hospital acquired infections. Another important transmission is a droplet transmission. Here, assessment is through respiratory droplets which are being carried for carrier of infectious pathogens. In addition to this, HAI, it's found that droplet transmission is being generated through sneezing or coughing or by uh, counting of the other counting by the other patients. According to these stats, it is found that overall expenditure of healthcare in New Zealand healthcare facility, approximately 11% of its 11% of the total GDP, total country's GDP is spent behind the HIs for this particular transmission. These were the reports of 2015 and 2016. This we can see in the graph. Uh, uh, here that HIV TB they in this graph is male compared between male and female by male and female in the of for the time frame of 2000 till 2012. This graph clearly shows that between the time frame of 2000 to 2000 till 2012, and particularly New Zealand healthcare settings, there are the most typical was in male as well as the female HIV and TB, TB and malarial infection. These also includes some diseases which are more of hospital acquired, which includes cancer as well as so many other diseases. In this graph also shows that uh, there was almost similar kind of ratio till 2000 to 2012 in male, but in female in 2000 it was less as compared to 2012, which has increased. So this shows that UTI infections or the lower respiratory tract infection in particularly females are increasing. Now we will discuss the second part is of risk associated to the hospital acquired settings, which includes common cold, diphtheria, uh, uh, proteosis, mumps, mycoplasma, influenza, and many others, which also includes the diseases like Ebola and Mtiago. All these mentioned diseases are considered to be the most crucial risk assessments. This has been considered via mode of via its mode of transmission. As as we can see, the risks which are occurring due to these diseases are mainly diseases like complications like diphtheria, common cold, proteosis, mumps, which are due to the droplet transmission. It has been stated in the Journal of Ecoshomi in 2016 that uh, the occurrence of virus or bacteria has been traveled from relatively a large respiratory healthcare settings, which is which of which is every an individual uh, faces through coughing, sneezing, when they exhale the organisms, and these are mainly responsible for influenza viruses. On the other hand, this type of risk assessments are precisely affiliated by the various infection particles. These have been stated in the Times 2016 journal. In addition to the hospital-acquired settings, it has been revealed that there must be a huge impact of microbes in New Zealand and other international as well as the other national boundaries. Moreover, the risks associated to are being enhanced due to some unhygienic atmosphere maintained in the hospital settings. Hence, in order to mitigate this sort of significance, it is a requirement to implement or control practices for this for the betterment of hospital acquired settings. Uh, in addition, the other main risk for this significantly emphasized are influenza, Mtiago, Ebola, which are transmitted through other modes of transmission of diseases. Like Ebola is transmitted from animal to human, and so these sort of diseases like meningitis, mycoplasma, These are been affiliated by high level. These are high risk diseases. Uh, those are considered to be the elements of those are considered to be the more virulent elements of New Zealand healthcare settings. Moreover, the associated risk factor of these diseases are due to the autoimmune diseases like in meningitis. It's because of an autoimmune disorder. This provides a relatively more concern to reduce its uh, risk factors as it's quickly spreading. On the other hand, it is also possibility to suffer some skin infections like salmonella, and other microbes are responsible for the skin infections. However, associated risk for these assessments is being infected for Ebola virus leads to be high and extremely more dangerous. The risk majorly associated for the hospital settings is the more elaborated and more longer stay of hospitalization. It also includes it may lead to the death of the patient when there is a longer stay of hospitalization. On the other hand, a body is exposed to an organism which was unknown. So this also includes the pathogenicity and more resistance of body towards the organism. There are some guidelines made nationally as well as internationally, and they are also followed in New Zealand. Mainly, the guidelines followed in New Zealand is the environment and infection prevention control guidelines, hand hygiene, isolation prevention, injection and safety guideline, antimicrobial stewardship guideline, healthcare personnel, improvement in longer hospital healthcare facility. These are few guidelines which are mainly focused in hospital of New Zealand. New Zealand. According to the hospital acquired, according to the HAI, all these guidelines which are mentioned above are practiced for the need of controlling the risk assessment of disease as well as the possibility of infection from an infected people. So they are not infecting to the non-infected people. So, infection control guidelines are promoted for the activity of considering to be the most important programs which is required for the implementation of healthcare settings in New Zealand. Previous era there were no guidelines which were followed as the epidemiology has grown. There are guidelines made nationally as well as internationally for the betterment of patients as well as the society. So the risk can be retarded or reduced. However, another infection control guidelines such as antimicrobial stewardship guidelines and hand hygiene are for the improvement of the long-term healthcare facility. In injection safety guideline is incorporated to prevent the transmission from an infected individual to the non-infected individual for the safety program. In addition, there is also this is also required to have an infection control progress for increasing the flexibility of healthcare facility, which can be stated in this graph. Some international guidelines includes improvement in policy of mechanism, implementation of the safety program for production for protecting the communities and healthcare personnel and other patients, increase immunity healthcare facility, reduction of inappropriate utilization of catheters. These guidelines are made internationally, which also includes some which country by country differing is different are hand hygiene guidelines and stewardship guidelines, antimicrobial stewardship guidelines. This international healthcare system of UK is increasing the concern to reduce the effectiveness for improving the healthcare quality. In addition to this, there are some policymakers of international healthcare facility who have focused more determination policy for mechanism of reducing the number of infection. Therefore, in order to align this, there is a requirement to identify relatively evidences for infection control program to prevent as well as control the healthcare oriented program. On the other hand, the policy discussion of healthcare practices is also supposed to have implemented evidence based organizational programs for preventing organizational infection. In other words, this includes the utilization of catheter is affiliated for maintaining the cleanliness in hospital settings. All in this, I would like to conclude by saying this: the above said and the brief paper of Part A and Part B is premised to for holistic as well as the brief discussion on educational resources in New Zealand and New Zealand as well as the international organizations. By analyzing the overall discussion, it can be summarized that healthcare organizations must associated to for appropriate industrial structure and as well as for the management of system by which they can obtain a proper quality based healthcare facility for the patients. Therefore it's aligned that therefore there have been this has been mentioned for various transmission based methods for risk frame and uh, so on for the other facilities. Thank you very much for giving me chance to speak on HAI, hospital acquired infections. Thank you.